Hi, my name is Janet. I am from Rasmussen College. I would like to speak to you a bit about one of the most common viruses in the United States, and this would be the herpes virus. This is a sexually transmitted disease of the skin, and it can affect the nervous system. This is a disease that once you get it, unfortunately, you are stuck with it for life. There is no getting rid of it, there is no cure. However, you can manage it and you can live with it with proper medication through your doctor. People who do get it don't always know that they have it. They don't always show the signs or symptoms right away, especially if they don't know they have it. And it depends on if they get a mild or severe case of it. Many people, depending on their stress level as well, can either trigger a small outbreak or a bigger outbreak, and then it would be more presentable to the person. You would see signs of it. Um, it usually affects about 1 in 5 females and 1 in 9 males, and usually ranges around the ages of 14 to 49. And you should assume that anybody you come in contact with, or I should say that you are in a relationship with, you might want to assume that they might have it and take precautions, even ask some questions before becoming sexually active with your partner for this particular reason. The herpes virus comes in two different types. It comes in herpes type A and herpes type B. There are many forms of these viruses. The types of viruses of the types of viruses that would include but are not limited to is herpes gingivitis, which appears on the gum line and the first place for the virus to show. Uh, Labialis is when you come in contact with abraded skin. It will look like a rash or some bumps on there. It won't look normal, obviously. Uh, it will look like they're having some kind of an outbreak of some form, like outbreak of rash or allergic reaction. Herpes genitalis is where the infection is in the genital area. Herpes whitlow is on the fingers or the cuticles of the fingers or toes. Gladiatorum appears on the neck, the ears, the face from participating in certain sports such as soccer, wrestling, or football. Herpes encephalitis and herpes meningitis is what affects the brain and and primarily attacks the temporal lobe from a sore on the face. Herpes esophagitis can affect the ability to swallow due to soreness and swelling when the virus is contracted in the throat. Herpes A is basically just having a cold sore on the lips. The symptoms of the herpes may be as simple as like a pimple, like bump, um, and with a very short period of time, it can actually become a much bigger problem. It doesn't take very long, sometimes even overnight. It forms into like a blister and can be very painful all at the same time and itchy. Sometimes you can have more than one at a time, and when this happens, you don't want to touch it with your hands. You want to keep your hands away from your face or any part of your body that does have it, because if you touch it, you can, give it to somebody else if you touch them with that skin that has come in contact with the infected area. The best thing to do to start off when you have this is to take a wet cloth and make sure you use hot water, and you can dab it on there to try to kill some of the bacteria off. It's not going to do a lot, but it might help to calm it down and relax it. You also want to go to your local drugstore and pick up a lip therapy called herpes L. It's one of the most common lip therapy treatments to help take care of something like this, because it's not just your typical little cold sore or fever blister. This is being considered the herpes virus, and you need the right medicine to treat this to help it to go away, and so that way you don't contract it to somebody else. Um, herpes, herpes virus can enter your central nervous system and do damage to the immune system. Um, when the virus enters your system, it stays latent in the ganglia, a nerve cluster, a nerve cell cluster, and the process of the outbreak will begin. Outbreaks can happen very often in the first year, and then they will slowly taper down as you get it under control by your doctor. So when you do feel like you've come in contact with it, you need to contact your doctor right away, so that way he or she can do a blood test to check to see if you have contracted it. Herpes B is when it affects the genital area. This is where the herpes can hurt the most. Intercourse is where herpes V virus commonly happens. In the early stage of the virus, some people don't experience the symptoms for at least 2 to 6 days. You will feel a little discomfort to feeling severe pain and some itching in the genital area and near the penis or the vulva area. Sometimes men can get it on the lips as well as the females. In women, if it starts out in the lower extremities, it would be in the cervix or the vagina. Other areas that can get sores are on the buttocks, the thighs, additional areas, obviously the skin, would be the neck, different, parts you want to keep an eye on it for. It can happen anywhere on your body, depending on if it's A or if it's B. If it's B, it would be more everywhere, on any different areas in the body, such as, like I said, the ears, the neck, and all that. Some of the symptoms that you might feel when having an outbreak would include chills, fatigue, swollen lymph nodes, or swollen lymph glands. It would be very common for somebody to be unaware that they're infected with this, especially if it starts out like a typical cold, sore, or fever blister. When that is the case, there's a bigger risk of transmitting it to somebody else. There's no form of protection is going to stop you from getting this. Even if you use a condom or any other form of contraceptives, nothing will keep you 100% from getting it, because it is that spreadable. If you do have unprotected relations with someone who does have it and they're not under treatment for it, you need to contact your doctor right away. The doctor will perform a blood test. It will only take a couple of days. And once your doctor has confirmed your diagnosis of the herpes virus, whether it be A or B, you will be started on a daily regimen of medicine that is out available. One would be called a cyclovir, and the other one is valacyclovir. Valacyclovir are some of the most common form of treatments available. If you have a lot of pain with it, you can use ibuprofen or acetaminophen to help calm down the pain. If you are pregnant after the virus has infected your body, your doctor may treat you with one of the medications available, and also you will end up having probably a C-section instead of giving normal vaginal birth, because if the baby does come out through the vaginal canal, you will risk your child contracting the disease, whether you're having an outbreak or not, and you don't want to end up passing it along to your child as it comes out. Outbreaks will not happen all the time. As I said before, future outbreaks determine how much stress you're under, or if you've come in contact with it, with somebody who has a bad outbreak, you can get a pretty severe one that way as well. Some of the biggest reasons why your body would cause you an outbreak would just be from underlying health problems. It can cause it to be worse, but basically just getting it from somebody else. If you plan to become sexually active, I would suggest using protection, take precautions when becoming intimate. If you're not aware of whether or not they have it or not, nothing will protect you from it. You will not die from this virus. It can make you feel ill at times, but you can live with it. Please take precautions for your partner if you have contracted the virus. See a doctor for testing, treatment, and any other health precautions that may help. Please be aware that Many things can trigger these um, outbreaks, but they can calm down. You can live with it, but just take precautions for your partner. And I hope this has been very informative for you. And I apologize for my voice. And I hope this will help you in the later.